Welcome to Cognition 360 Health. We're talking about iron deficiency anemia, the most common form of anemia worldwide. We'll cover what causes it, the symptoms, how it's diagnosed, treatments, and some lifestyle tips backed by scientific research. Let's dive right in. 1. What is iron deficiency anemia? Iron deficiency anemia, IDA, is when the body lacks enough iron to produce hemoglobin, the protein in red blood cells responsible for transporting oxygen. Hemoglobin production decreases, resulting in fewer and less efficient red blood cells, which leads to symptoms like fatigue, weakness, and dizziness. Supporting research. According to the World Health Organization, iron deficiency is the leading cause of anemia worldwide, affecting 1 in 4 people globally. This issue is especially prevalent among women and children due to factors like menstruation, pregnancy, and nutritional deficiencies. Key points. Iron deficiency anemia is the most common type of anemia, impacting over 2 billion people worldwide. Hemoglobin relies on iron for oxygen transport throughout the body. 2. Causes of iron deficiency anemia. Dietary deficiency. Low intake of iron-rich foods can lead to iron deficiency. This is especially common in populations with low meat consumption or diets lacking in diverse nutrient sources. Research insight. A study published in the American Journal of Clinical Nutrition found that vegetarians and vegans have a higher risk of iron deficiency anemia due to the absence of heme iron from animal sources, which the body absorbs more efficiently. Blood loss. Menstrual blood loss, gastrointestinal bleeding, like ulcers or polyps, and surgeries can cause significant iron loss. Research insight. According to findings in the New England Journal of Medicine, blood loss is one of the most common causes of iron deficiency anemia, with menstrual blood loss accounting for up to 20% of all cases in women of reproductive age. Increased iron demand. Pregnancy, breastfeeding, and periods of rapid growth, like adolescence, increase iron demand. Research insight. Studies in JAMA Pediatrics indicate that adolescent girls are particularly vulnerable to iron deficiency due to the combined effects of growth and menstrual blood loss. Malabsorption. Conditions like celiac disease, Crohn's disease, and certain surgeries, e.g., gastric bypass, can impair iron absorption. Research insight. A study in gastroenterology highlighted that patients with gastrointestinal disorders are at high risk of iron deficiency anemia due to poor iron absorption in the small intestine. 3. Symptoms of iron deficiency anemia. Iron deficiency anemia has a range of symptoms that can vary in severity, including fatigue and weakness, pale or yellowish skin, shortness of breath and rapid heartbeat, headaches and dizziness, brittle nails, hair loss, and unusual cravings like ice, a condition called pica. Supporting research. A study in the BMJ found that fatigue, pallor, and breathlessness are some of the most common early symptoms of iron deficiency anemia, often mistaken for general tiredness or stress. 4. Diagnosis of iron deficiency anemia. Diagnosing iron deficiency anemia involves several key blood tests. Complete blood count, CBC, measures hemoglobin, hematocrit, and red blood cell count. A low hemoglobin level is usually the first indication of anemia. Ferritin test. Ferritin is a protein that stores iron, and low ferritin levels often indicate depleted iron stores. Research insight. Research in the Journal of Clinical Pathology highlights that ferritin testing is one of the most reliable markers for diagnosing iron-deficiency anemia, as low ferritin levels correlate closely with iron deficiency. Transferrin saturation. Transferrin is the protein that carries iron in the blood. Low transferrin saturation indicates a deficiency of iron available for hemoglobin production. Reticulocyte count measures the number of young red blood cells in the blood, providing insight into bone marrow activity in response to iron deficiency. Supporting research. According to the American Society of Hematology, early diagnosis using ferritin and transferrin tests is critical for effective treatment and management of iron deficiency anemia. 5. Treatment of iron deficiency anemia. Oral iron supplements. Most people with iron deficiency anemia start with oral iron supplements, typically ferrous sulfate or ferrous gluconate. Research insight. A study published in The Lancet Hematology showed that oral iron supplements are effective in raising hemoglobin levels within 3 months, although gastrointestinal side effects like constipation are common. Intravenous, IV, iron therapy. For people who can't tolerate oral supplements or have malabsorption issues, IV iron is a good alternative. Research insight. Studies in the New England Journal of Medicine indicate that IV iron is more effective and quicker than oral supplements, especially for patients with inflammatory bowel disease and other malabsorption conditions. Dietary changes. Adding iron-rich foods to your diet, like red meat, fish, legumes, nuts, and fortified cereals, can help. Research insight. A systematic review in the American Journal of Clinical Nutrition showed that dietary changes alone improve iron levels in individuals with mild anemia over 6 months. 6. Natural and lifestyle approaches to boost iron. 1. Incorporate non-heme and heme iron sources. Heme iron from animal products is more easily absorbed than non-heme iron from plant sources. Aim for a balance if you follow a plant-based diet. Supporting evidence. Research in nutrition reviews suggests that pairing non-heme iron with vitamin C, like combining spinach with a citrus dressing, increases absorption rates by up to 70%. Vitamin C intake. Foods high in vitamin C include oranges, strawberries, and bell peppers. Avoid iron inhibitors. Substances like caffeine, calcium, and tannins can reduce iron absorption, so try to avoid tea, coffee, or dairy around mealtimes when you're consuming iron-rich foods. Research insight. Findings in the European Journal of Clinical Nutrition recommend spacing calcium-rich meals or coffee breaks at least an hour apart from iron-rich foods for optimal absorption. Herbal options. Herbs like moringa, dandelion root, and nettle tea have been traditionally used to help with iron deficiency. Moringa, in particular, contains a good amount of iron and vitamin C. Supporting research. A study in phytotherapy research found that moringa supplementation helped improve hemoglobin levels and iron stores in people with mild iron deficiency anemia. Note: always consult a healthcare provider before starting any natural or herbal supplements. Iron deficiency anemia is a common and treatable condition, but catching it early and following the right steps is crucial. Whether through dietary changes, supplements, or medical treatment, managing iron deficiency anemia can significantly improve your energy levels and overall health. Thanks for watching. If you found this information helpful, please give this video a thumbs up, subscribe, and share it with others who might benefit from it. Until next time, stay healthy and informed.